I'm Andrei Shustov. I'm a faculty member at the University of Washington and Fred Hutchinson Cancer Research Center in Seattle. I treat patients with lymphomas and leukemias, and focus of my clinical research and clinic are T-cell leukemias and lymphomas. I deal with all types of lymphoid malignancies, but the major focus is on T-cell cancers. So Dr. Yeon Kim, the principal investigator, presented results of our ALCANZA trial. That was a randomized prospective trial of brentuximab vedotin targeting CD30 in patients with cutaneous T-cell lymphomas. Remember that previously brentuximab vedotin showed remarkable activity in systemic CD30 positive lymphomas like anaplastic large cell lymphoma, Hodgkin lymphoma, and new studies coming out in CD30 positive T-cell lymphomas and even negative diffuse large B-cell lymphoma. So ALCANZA trial was a randomized study where patients with skin lymphomas, mycosis, fungoides, Sézary syndrome, and other CD30 positive lymphomas were treated either by investigator choice treatment or brentuximab vedotin. And at the end of the study, it turned out that those patients treated with brentuximab vedotin had significantly improved outcomes compared to treatment of choice. Therapy was intravenous every 3 weeks at standard dose of brentuximab vedotin 1.8 milligram per kilogram. It was very well tolerated. As expected, some patients developed peripheral sensory neuropathy. Very few patients motor neuropathy. It is not difficult to deal with that as a treating physician. You have to be very careful monitoring, and if you catch it early, you can reduce the dose, you can stretch the intervals, and patients tolerate treatment quite well. And in those patients that stop therapy because of the peripheral neuropathy, in half of them, the syndrome resolves, and another 20–30%, it gets better. It is only 20% of patients who have severe symptoms would still have neuropathy longer than a year or a couple of years. So overall, treatment was well tolerated. It was very beneficial, and we are very excited to have this option now for patients, especially with aggressive and refractory cutaneous T-cell lymphoma. So I think it is a great advance for us hematologists dealing with lymphoid malignancies. It provides a very powerful tool to help these patients.